Peace be to you all. This is Omar Abdul Malik, physician associate and health educator. So I am going to broach a hotly contested issue that affects healthcare while I do my power walk. And that issue is immigration. I've had some questions about this from people trying to come to the U.S. to practice as clinicians, specifically physician associates and physicians. I don't know all of the idiosyncrasies and the intricacies of immigration policies. I want to say that right there. It's my opinions are my own. It's based on my experience as an educator and a healthcare provider. So when it comes to education, it does impact our education system when you have people that may not be well versed on American culture, for better or for worse, what constitutes American culture, and you're coming into an American school system and you're trying to adapt to that, whether that is secondary school or college. There's issues there, and I've had patients or students rather. I taught on the collegiate level. I was a college professor years ago. There were, and I taught at HBCUs. So we had a lot of immigrants at that school. And sometimes in my classes, that became an issue when cultural differences, you had a kind of clash of cultures, as it were. I'll be out of breath. I got to go up this really steep hill. It's about 45-degree angle. But that would affect the class dynamics. We'd have to educate people, we being fellow faculty and myself, on now you can't do that in this country. You can't treat women in that way in this country. You can't say that to this person in this country. I actually had two classmates that were from countries who were at war, and they actually made it a point to get along, which I always found really to be a commendable thing. My God, it's steep. But it's kind of a learning process. All of us are descendant from immigrants, with the possible exception of the First Nations people. Some of us were brought here voluntarily or involuntarily. Others of us came here as a haven from war-torn and economically depressed countries, and others were seeking asylum from political and religious and ideological oppression. Now, that segues to the healthcare issue. I have worked at and volunteered in healthcare capacity to the immigrant community. It can be problematic in that, look at that, whew, came all the way through. Oh God. It can be problematic when you're providing services on a professional level and that person is undocumented. I eschew using the term illegal, because not everybody that is within our borders who is not an American citizen is here illegally. Some are visitors, some have student and work visas, others are asylum seekers. I had a young man he was a gay guy, and in this particular country, they killed people like him. Even his own father had threatened to kill him. So, the place where I worked at the time, we appealed to the judge and tried to help him get, true asylum so he could get some benefits in the U.S. And that wasn't easy because it dealt with a lot of legalities and so forth. And when a person's seeking asylum, they have to prove that their life is in danger if they go back to their country of origin. And I've had classmates who are in similar situations, asylum seekers. The issue becomes problematic when you're trying to render healthcare services to groups of people who are not documented immigrants, because now they take a toll on the healthcare, the whole healthcare industry, or I should say healthcare services. As vast as those services seem to be in the U.S., they're not limitless, So when we have people here for whom you're not able to bill an insurance company because they're not eligible for insurance, even things like Medicaid or Medicare, you're not going to reimburse, you're not going to ever recoup your services. And if you have to do things like write prescriptions, then how's that person going to get those prescriptions filled if they don't have insurance? And hi there, pardon me, good day to you. If they're not able to pay, one place where I worked, we had we being the staff, and I got some cash together, and it was used as funds to help people, undocumented immigrants, pay for their medications, because we had folks with with chronic diseases. After 50 you get stuff, so type 2 diabetes, hypertension, hyperlipidemia, that kind of thing. And so those bills add up. And forget about going to the hospital. And I've spoken to hospital administrators about this. Fun fact about me: I'm ABD, all but dissertation in health administration. So I had to study this stuff on an academic level and theoretical level, but I actually experienced it and observed it. So a lot of these folks use the emergency rooms, in particular emergency rooms in depressed areas, whether it's a rural hospital, a rural area, or an urban setting. They use the emergency department as their primary care. So they'll go in, let's say a gentleman from whatever country, he's not documented, and he comes into the emergency room with, acute abdomen, acute pain in the abdomen. Well, maybe you're going to do a KUB, an abdominal x-ray, and then a CT, a computed tomography to check out of the abdomen. Well, that's thousands of dollars. Then if you're gonna consult with the gastroenterologist, hey, that's more money. So how do you get your money back? And then that person gets a bill. Well, if they're undocumented, they may or may not care about paying that bill. They don't necessarily care about their credit score. And that's not to negatively stereotype immigrants, specifically undocumented immigrants. But I'm just saying, it's a matter of priority. If your priority is food and shelter, that's Maslow's hierarchy of needs. You're not worried about paying a hospital bill of several $1,000s that you can't really pay. So there's issues there. And I think, living in Washington, D.C., that's been hailed as a as I think we're a safe haven for immigrants, especially during this when we were dealing with DACA during the previous administration. There's issues there and challenges to meet. I don't have any panacea to it. There's no cure-all, no pun intended. But I don't know. I'm curious to see what you guys' thoughts are on this immigration issue and how it can affect healthcare and higher education. I would say that's the experience that I have. Anyway, I wish you guys the best of success in your positive endeavors. My goal is not to offend anyone, but rather to open up a dialogue and to educate and be educated. But if you're interested in becoming a PA or a health educator, please consider subscribing. If not, that's too cool too. Take care.